So I'm Terry Bradford. I'm the caregiver specialist for Brown County.
Thank you, Terry, for joining. I appreciate it.
I think I have it working.
You do. Thank you, Carol. Well done.
I'm Carol Bagda. I work for the Oneida Nation Aging and Disability Center. I'm the Native American Family Caregiver Coordinator and Outreach Worker.
Wonderful. Thank you for joining us. Amy. Okay, moving on from Amy, Donna.
Hi, I'm Donna Richards with Adams County, and I'm the Aging Division Supervisor or Manager, and I am in charge of all the caregiving, support, respite, and other programs.
Wonderful. Thank you for joining us. I do see that we have others as well to take time and introduce, but I'm going to stop for just a second to see if Leland has joined us so that we can give him and his material opportunity. Again, hang on, user error. Okay. Leland, are you on right now? Okay. Well, we'll continue with introductions, and I do know that Leland was sick this week, and he emailed and he wasn't sure if he would be able to present. I did get word from him this morning that he was feeling well enough and thought he could. But I share that because we did have a plan B, and that is Lynn has some info. Oh, we should probably introduce who you are. Lynn has some information that she would like to share, and then we'll continue to take time to do introductions and kind of get to know one another a little bit. But maybe before I jump back to the virtual screen, I'll jump back here in person. In addition to Lynn, would you introduce yourself and anybody else who might have joined?
Sure. Hi, everybody. I'm Lynn Gall. Nice to see you all in person. I'm sorry I missed that round of introductions, but got caught in some rain. I'm with the state DHS Office on Aging, and I'm the Family Caregiver Support Programs and Lifespan Respite Programs Coordinator and Manager. So I'm sure you've seen me on calls or gotten emails from me. So it's great to see you in person.
Thank you. Gary, way in the back, you want to share who you are?
Sure. I'm Carrie Kretz, for those of you who don't know me, and I oversee the WellSky SAMS information along with a lot of your fiscal information for the federal reporting, which is coming up. October 31st is deadline. There, I put my plug in.
No pressure, okay?
Yeah, no pressure. It's tomorrow. No, just kidding.
On November 1st.
Right.
Hello, I'm so sorry. This is Leland King. I thought I joined by Teams, but I apparently did not. So I'm here now. So I just wanted to let you know that.
Thank you so much. I appreciate that. We had a good use of time. We just went around and shared a bit about those both here in person and then those joining us where they were joining us from virtually. So I will turn it over to you so that you have the time that you needed to share the information. Are you comfortable sharing your screen? If not, I do have it saved on the desktop as backup.
I'll go ahead and share my screen. Thank you so much for inviting me. I am recovering from an illness, so if I have to blow my nose every now and then, I apologize. Hold on, please. Can you see my screen?
We can.
Okay, let me just change the slideshow. So welcome to the Kinship and Grandfamilies Child Welfare and Aging Network Supports. My name is Leland King, and I'm a program manager at US Aging, overseeing our partnerships with Generations United and 4 other national nonprofits in the Grandfamilies and Kinship Support Network, a national technical assistance center, which is funded by the U.S. Administration for Community Living and run by Generations United. The Grandfamilies and Kinship Support Network is the first ever national technical assistance center for those who serve and support kinship and grandfamilies. On its website, gksnetwork.org, you can find professional resources like fact sheets such as those on school breakfast and lunch programs, guides like those on best practices for engaging with Black and Indigenous kin caregivers, and live and recorded webinars on professional topics such as finding legal resources for kinship and grandfamilies. All resources on the website are available at no cost. No-cost technical assistance, including presentations like this one, linkages to subject matter experts, and guidance on policies and practices is available to nonprofits, government agencies, and tribes working to support kinship and grandfamilies. To request technical assistance, visit the Grandfamilies and Kinship Support Network website. This morning, we will be reviewing who kinship and grandfamilies are, taking a high-level look at child welfare, and summarizing aging network services that might entice kinship navigators to collaborate with you. Because we have a lot to cover, I'm going to ask that you hold questions until the end of each of the 3 sections. Also, just as a disclaimer, while I have 19 years of experience in aging services, I'm relatively new to children's services. This is one of the reasons why my presentation today includes a high-level overview of child welfare. Later, over the coming months, you'll hear from other speakers from the Grandfamilies and Kinship Support Network who will give in-depth presentations on child welfare, other services, collaboration best practices, identifying a champion, and more. So before we talk about services, let's talk a little bit about who kinship and grandfamilies are. Let's start with this video if I can get it started. Where's my first?
Leland, we're not able to hear the audio. Any chance you can share the link in the chat and I could click on the link?
Sure.
Otherwise, too, if you
Yes.
can share at the very top, it also says to share audio.
Oh, say that again, Carrie. Way at the top, there's audio.
Yeah, if you stop sharing,
Oh, yeah.
share
Okay,
at the
look,
top, it should say share audio.
I have it here. Thank you so much. Okay, let's try that again. Can you hear it?
Are you a grandparent raising their grandchildren, an aunt or uncle raising their niece or nephew, or even a coach or teacher raising a student? Then you are considered a kinship family member. Did you know there are 2 types of kinship care? Formal and informal care. Informal would be if the children's arrangements were made by parents and other family members without any involvement from a child welfare agency or court. Formal care would be children placed in the legal custody of the state by a judge, and the child welfare agency then places children with kin. Across the nation, 4% of all children, that's more than 2.6 million children, are in kinship care. If you are caring for a child in a situation like this, not only are you a kinship family member, but there are resources and opportunities to support you.
You hear that?
Yes, thank you.
Oh, cool. Okay, let's see. Oh, sorry. I didn't realize it was going to start again. Oh, there we go. So what else do we know about these families? Kinship families, also known as grandfamilies, are families in which grandparents, other relatives, or close family friends are raising children whose parents are unable to do so. These families come together for a variety of reasons, including military deployment of the parents, substance abuse, parental incarceration, or parental death. From here on in, I'll be using the terms kinship family and grandfamily interchangeably. I'll also be using the term kin caregiver to describe grandparents, other relatives, or close family friends providing primary care to children. Slide. We know that 2.7 million grandparents are raising their grandchildren. 1 million other kin, like aunts and uncles, also raise relative children. And 2/3 of grandparents raising grandchildren are age 55 or older. What we know about kin caregivers is extrapolated from what we know about grandparents raising their grandchildren. This is because national data sources like the census only describe this population as kin caregivers. The data tells us that 69% of grandparents raising grandchildren are married. 44% are no longer in the workforce. 25% have a disability, and 18% live below the poverty line. Even grandfamilies with resources may face financial strain by taking in a child they weren't expecting. With the average cost of raising a child well over $13,000 per year, that can be quite a hit. This slide indicates that 46% of grandparents raising children are 60 and older. You may recall that the last slide shows that 2/3 are age 55 and older. Both are true. We also know that there is an overrepresentation of African American and Native American families within grandfamilies. This is partly due to cultural strengths like traditions of extended family caring for one another. Of course, we also know that it is partly due to a long history of discriminatory policies against these families. Additionally, we know that most children in grandfamilies are outside of foster care. You may recall that the video we watched referred to formal and informal kinship care. Formal care describes grandfamilies within foster care, whereas informal care describes grandfamilies that are not involved with foster care. This slide, as you can see, shows that 18 children are being raised by kin outside of foster care for every child within it. This distinction between formal and informal care is important, and the consequences become apparent when we discuss child welfare. Like all families, kinship families have both strengths and challenges. We've already discussed some of those challenges, but to review, 18% of grandparents raising grandchildren live below the poverty line. 25% of grandparents raising grandchildren have disabilities, and many children in grandfamilies also have disabilities. Grandfamilies also have some unique challenges. Many of us plan for having children. We think about when might be the right time and whether we can afford them. We may move to a larger home in expectation of children. Kin caregivers rarely have this luxury. Children frequently arrive at a moment's notice, often following a traumatic event like a parent's overdose or incarceration. The kin caregivers may have downsized because they weren't expecting children at this time of their lives. They may be living in senior housing that doesn't allow children. Children who have survived trauma may have behavioral or developmental needs that can be stressful for those providing care. Welcoming relative children into their homes frequently requires grandparents, aunts and uncles, and close family friends to transition from the fun uncle, aunt, or adult friend, or from the grandparent that spoils their grandchildren, into a parent figure or disciplinary role. Kin caregivers also may need to learn to navigate new and often challenging roles with the biological parents of the children they are raising. Unlike birth parents, kin caregivers do not have an automatic legal relationship to the children. This may mean, depending on where they live in the U.S., that they may have difficulties enrolling the children in school, obtaining certain public benefits, or even consenting to medical treatment. Despite all these challenges, we know that grandfamilies benefit both kin caregivers and the children they are raising. Research shows that when compared to children in non-relative foster care, children in grandfamilies enjoy greater stability, safety, and well-being. They develop stronger adaptive behaviors, benefit from preferable mental and behavioral health outcomes, and are more likely to stay connected with their siblings and their culture. A strong cultural identity, studies show, increases a child's self-esteem, decreases loneliness and depression, and is associated with higher educational attainment. Kin caregivers report feelings of joy and an increased sense of purpose after welcoming relative children into their home. If you would like to learn more, here are some other resources you might explore. And Bryn has a copy of my slides, which you're welcome to share with everyone. Are there any questions so far? Okay, well, I'll just continue then. Now I'm going to give a high-level overview of child welfare. As I mentioned earlier, my knowledge is primarily of the Aging Network. We wanted to share information on child welfare since it is an important partner when working with kinship families. As such, I will try, but may not be able to answer all of your questions about child welfare. Later in the series, you will hear from another speaker from the Grandfamilies and Kinship Support Network who will provide more in-depth information. So what is child welfare? Child welfare is a complex system of programs and agencies geared toward keeping children safe and supporting families. The federal oversight and funding originates with the U.S. Administration for Children and Families. It's the states that have primary responsibility for administering child welfare. As such, regulations including scope and eligibility vary somewhat state by state. And local service providers may include social services and child family service departments, private welfare agencies, community-based organizations, and more. Before we go any further, let's clarify some terms. Many programs within child welfare are funded under the Title IV-E of the Social Security Act. These include foster care, the Adoption Assistance Program, the Guardianship Assistance Program. For this reason, these agencies that oversee these programs are often called Title IV-E agencies. In some cases, the term Title IV-E agency may be used to describe only a foster care program. Title IV-E agencies are also called child welfare agencies. You also may recall that the video we watched, the speaker described the differences between formal and informal care. Formal care describes the situation where the children have been placed into kinship or foster care by the courts, and the child welfare agency has custody. Kin caregivers and children in formal care are also said to be inside the system. Informal care refers to situations in which kin caregivers arrange to provide primary care to relative children without any involvement of the courts or the child welfare agency. Grandfamilies in this situation are said to be outside the system. While the terms formal and informal care, are widely used, these terms present challenges in that families outside the child welfare system may feel disrespected by the term informal care. The terms involved in foster care and not involved with foster care attempt to ameliorate this. Two more terms to be aware of are licensed foster parents and not licensed. A licensed foster parent refers to a person who has been approved by the government to care for foster children in their home. Though the licensing process varies from state to state, it typically includes background checks and an agreement by the foster parent to follow certain rules. Some jurisdictions also require aspiring licensed foster parents to complete training courses before they can receive children into their home. Wisconsin's foster care licensing rules can be found in the Wisconsin Administrative Code, Chapter DCF 56. Kin caregivers who are not licensed by the state have not completed the licensing requirements. Generally, foster parent licensing occurs prior to foster parents welcoming children into their home, whereas kin caregiver licensing, if it occurs at all, happens after the children have been welcomed into them. I'm so sorry for the phone if you can hear it. It's possible, therefore, for grand families to be inside the child welfare system and licensed, inside the child welfare system and not licensed, and outside the child welfare system and not licensed. These distinctions are important and greatly affect what support and oversight they receive from child welfare. One more variation. It's also possible that families were involved with child welfare but are no longer. This most frequently occurs when Child Protective Services makes an investigation of a family and then requests that the kin care for the child outside the child welfare system. This practice is also known as diversion. Because it's less costly for the child welfare system if a family is outside the system, some child welfare programs encourage child welfare workers to divert families away from the system. Ideally, when this occurs, the worker would weigh the pros and cons of doing so with the family. However, many times kin caregivers are asked to take on the children outside the system without being told what services and supports the family might lose in doing so. As I mentioned, the level of support a family receives from a Title IV agency or child welfare varies depending on the family's relationship with the child welfare system. Those families that are inside the system and who are licensed receive a caseworker who must help them navigate the system and make decisions regarding various options. Those families that are inside the child welfare system and who are not licensed also receive a caseworker, but the caseworker's responsibilities may not be as clearly defined. Those outside the child welfare system do not receive a caseworker. You may recall that for families inside the child welfare system, the Title IV-E or Child Welfare Agency has legal custody for the children and thus can consent to the child receiving health care. Kin caregivers outside the system do not have automatic child custody unless they pursued it legally, and so, depending on where they reside in the U.S., may not have any way of consenting to their child's health care. Also, for families inside the system and licensed, the child automatically gets Medicaid. For families inside the system who are not licensed, the child may or may not automatically receive Medicaid depending on the presiding jurisdiction. Kin caregivers outside the system and unlicensed must obtain health care coverage for their child on their own. This could include applying for Medicaid on behalf of the child, including the child in their private insurance coverage, depending on the rules of the insurance company, or purchasing separate insurance for the child. At some point in a grand family's evolution, kin caregivers may decide to adopt a child or pursue guardianship. Either way, an attorney may be needed to help with this process. Depending on state or local rules, kin caregivers inside the system may or may not get an attorney assigned to them to help them pursue guardianship or adoption. Interestingly, the child and the biological parents automatically get an attorney. Kin caregivers outside the system must hire a private attorney or, depending on their income, may qualify for subsidized legal aid. Note, though, that the subsidized legal aid under the Older Americans Act typically is not available to help with child adoption or child guardianship. Subsidized legal assistance for child adoption or guardianship cases may be available from grantees of the Federal Legal Services Corporation. Licensed families within the child welfare system, each foster child in the family receives income assistance through what is known as foster care maintenance payments. The amount paid is not a lot, on average nationally around $500 a month, but still helpful, especially to the 18% of grand families you may recall that live below the poverty line. Those families that are in the system but are not licensed or outside of the system do not receive any foster care maintenance payments. John H. Chafee Foster Care Program for Successful Transition to Adult funds states and tribes to help youth and young adults in foster care or who have recently aged out of foster care to transition to adulthood. States and tribes can use funds for a variety of things, including help with employment, housing, and financial management, and more. However, as with all child welfare services and supports, the availability of assistance from the Chafee program depends on the child's relationship with the child welfare system. Youth who are currently in foster care or who have recently aged out, whether or not their families are licensed or not licensed, are eligible for Chafee's program supports. Those who are not involved in the child welfare system are not eligible for Chafee supports. Kinship navigators, as you likely know, provide information and referral about local supports for grandfamilies. Grandfamilies inside the system are eligible for this service. Those outside the system may be, depending on local regulations. And unfortunately, I don't know whether that's true in Wisconsin or not. Kinship navigators also are a kind of unique beast within child welfare. While many child welfare programs run Kinship Navigator programs and federal funding comes through the Title IV agencies, some Kinship Navigator programs are run by other entities, including a few area agencies on aging. Federal funds are available to help support a portion of Kinship Navigator program costs, but are only available to those Kinship Navigator programs that meet the federal government standard as being evidence-based. As such, many Kinship Navigator programs rely on other funding sources, including state and local funding. Additionally, though established under the Federal Family First Prevention Services Act of 2018, Kinship Navigators were established as an optional program. As such, they are not available nationwide. If you would like to learn more, here are some other resources. Any questions about child welfare? Okay, well then I'll just move on. Bryn also asked me to talk about aging network services that might entice Kinship navigators to collaborate with caregiver coordinators. Before we do so, let's first start with a quick review of what the Aging Network is and how it operates. The Aging Network was established with the passage of the Older Americans Act in 1965 to support older adults aged 60 and older. Formally, the Aging Network consists of the U.S. Administration on Aging, which is part of the U.S. Administration for Community Living, the state units on aging, like Wisconsin's Bureau of Aging and Disability Resources, local area agencies on aging, like the Greater Wisconsin Agency on Aging Resources, Title VI Native American aging programs like Lac du Flambeau Aging and Long-Term Care Program, and the Aging and Disability Resource Centers, also known as ADRCs. Informally, it also consists of all the community-based organizations with which the area agencies on aging and Title VI programs contract to coordinate services. Area agencies on aging, also known as AAAs, have flexibility in choosing many of the services they offer. However, the Older Americans Act also specifies certain core services that all AAAs must provide or contract to provide. Specifically, all area agencies on aging must offer or contract to offer services to protect the safety and rights of older adults at home and in long-term care facilities. Services support family caregivers, nutrition services like home-delivered and congregate meals, health promotion like fitness classes and health screenings, and supportive services like transportation, information and referral. The Older Americans Act authorizes Title VI programs to offer a similar mix of services. Authorization to fund family caregiver services was added to the Older Americans Act in 2000 under the National Family Caregiver Support Program and the Native American Caregiver Support Program. Both these programs require agencies on aging and Title VI programs receiving funding to offer or contract to offer these 5 services for caregivers. Information for caregivers on available services. Sorry about that. Assistance to caregivers in accessing those services, caregiver respite, caregiver counseling, support groups or training, and supplemental services like home goods and clothing. Area agencies on aging and Title VI program receiving National Family Caregiver Support Program or Native American Caregiver Support Program funds must offer or contract to offer the 5 required services to family caregivers of older adults. They also have the option to offer or contract to offer these services to kin caregivers ages 55 and older, and most have opted to do so. Note that while most services authorized under the Older Americans Act are restricted to older adults age 60 and older, caregiver services for kin caregivers are available to those 55 and older. So why might the Aging Network be a key partner for Kinship navigators? You may recall that 46% of grandparents raising their grandchildren are age 60 and older. 66% are age 55 and older. 44% are no longer in the workforce, and 18% live below the poverty line. You also might remember that most grandfamilies are outside the child welfare system and are not licensed. This means they don't have access to many of the supports offered by child welfare, including income assistance like foster care maintenance payments. Kinship navigators can help grandfamilies outside as well as inside the child welfare system. Many are focused on the needs of the child and may not be knowledgeable or have expertise about benefits and supports for the older adult kin caregiver. The Aging Network, as you know, offers older adults age 60 and older expertise from benefits counselors on Medicare, Medicaid, and Medicaid for older adults, which for Medicaid frequently has a different scope and eligibility requirements than Medicaid for children, Social Security, and more. The Aging Network also offers no-cost services to older kin caregivers ages 60 and older trying to make ends meet, like congregate meals called senior dining in Wisconsin, and home-delivered meals. Some states, I'm not sure if Wisconsin is one of them, have opted to expand to eligibility for congregate and home-delivered meals to younger people with disabilities, including children who reside with an older adult eligible for these programs. You might recall how 25% of grandparents raising grandchildren have a disability. Many also have chronic conditions like arthritis and diabetes. In many states and localities, the Aging Network offers homemaker and chore services, in-home personal care, transportation, assistive devices, chronic disease self-management classes, and nutrition counseling. While not available at every area agency on aging, ADRC, or Title VI Native American aging programs, these supports, as you know, are available in Wisconsin. Kin caregivers, as we discussed, face some unique challenges. Children frequently arrive in a kin caregiver's home without notice and often following a traumatic event like a parent's overdose or incarceration. Because of this, many children and grandfamilies have emotional and behavioral challenges. As kin caregivers' legal relationship with the child or lack thereof may create barriers for the kin caregiver in enrolling the children in school, obtaining certain public benefits, or even consenting to medical treatments. Combined, all these challenges can cause stress and feelings of being overwhelmed. So how can the Aging Network help? The National Family Caregiver Support Program and the Native American Caregiver Support Program, you may remember, offers kin caregiver support groups, kin caregiver training, respite, information on available services, assistance in accessing those services for kin caregivers ages 55 and older. In those, excuse me, assistance in accessing those services for caregivers ages 55 and older in those places like Wisconsin that choose to use program funds to support this population. Excuse me. In fact, a survey on how the Aging Network supports grandfamilies, which US Aging completed for the Grandfamilies and Kinship Support Network in 2022, found that nationwide 87% of area agencies on aging and Title VI Native American aging programs report supporting grandfamilies with information on available services. 77% help kin caregivers access available services. 62% provide kin caregiver training or education. 59% offer kin caregiver support groups, and 54% provide respite. In Wisconsin, as I'm sure you're aware, you can find many of these resources via the Wisconsin Family and Caregiver Support Alliance website at wisconsincaregiver.org. If you'd like to learn more, here are some more resources. Any questions about anything I've talked about? This is my Yep.
Well, I was just gonna share, I don't see anybody. Oh, is there a question? Okay, I don't see anybody in the room or in the chat. Go ahead, I'm
Okay.
sorry.
That's okay. No, this is just my contact information. Feel free to contact me should you have any questions in the future. And otherwise, that's basically my presentation. Thank you so much for letting me come. And I'll stop sharing my screen at this point.
Thank you so much, especially not feeling 100%. We appreciate your time. That is helpful information. As Leland said, his slide deck or presentation will be available. I think it's the GWAR website, technical assistance, family caregiver support programs. And then on the bottom of the family caregiver support program, we have all of our state calls recorded. So that's where the recording will be along with the presentation. Leland also showed our wisconsincaregiver.org, and my predecessor, Jane, had done a wonderful job building out the resources available on the Grandfamilies and Kinship page. I too am working on filling a lot of that in from Generations United and US Aging. So hopefully you will have a bit more of a one-stop shop that you can share with people and maybe get information yourself. The other thing I would add is Leland mentioned a series on Grandfamilies and Kinship care. So there were 2 counties when we looked in the state over the past few years. I think it was 2021 to 2022. One county stood out as having a really consistently high percentage of kinship, and the other one was more of a spike, an increase. So maybe some additional outreach efforts or those types of things. So we'll be hearing from them in time to come, 2023 and ending in 2023 and probably in the beginning of 2024. So we'll have more resources as it relates to how we can support grandfamilies and kinship families and how we can connect to those kinship navigators that Leland had mentioned.
I'm noticing that Terry Bradford has her hand raised.
Oh, thank you.
Yeah, you guys, thank you so much, Leland, for the information. And I apologize, I was interrupted a few times during the presentation, so maybe I missed it. My biggest struggle is finding where to connect with those grandparents. We know how many hundreds of grandparents there are in Brown County. However, all of our efforts to reach out to them, given the number that we have in Brown County and the few caregiver grants that we have, uh, we're just not connecting with them. So I know that we can connect with social service agencies. I know I actually just had my first grandparent come over from the Kinship coordinator in Brown County sent her over. So that's possible. I know the schools and the medical providers. Are there any other ways to connect, and not just to Leland, but maybe even to the group? Any other suggestions that you guys might have as to where we can connect, how we can connect and get in front of these grandparents to offer the NFCSP funding?
That is actually a big issue nationwide. In that survey that we conducted last year, we did find that outreach was a big need nationwide among AAA's and Title VI programs. The Grandfamilies and Kinship Support Network on their website does have information about outreach strategies, and soon, hopefully, US Aging, on behalf of the network, will be completing a video on kin caregiver support groups offered by a AAA in Southwest Idaho, where they have some interesting outreach strategies to reach kinship and grandfamilies. It may not be possible depending on where you are and how big your staff is, but the Southwest Idaho group basically goes to a lot of community events, and they basically go to where families would go for fun, and not just where they go for information. So they're going to community fairs, and they're going to one of the kin caregiver coordinators in Southwest Idaho says she went to a Comic-Con conference. And and I don't know if that would be helpful. Again, it's going to depend a lot about how big your geographical area is and your staff, but that is one thing. The other thing is, I'm so sorry. We, at the US Aging Conference, we had a presentation, which was basically partnering for outreach. And I may be able to, Bryn, maybe if you could get me, Bryn, I'll email Bryn my slides for that presentation. And hopefully that will provide some help. We did not record that session, unfortunately.
Great, thank you.
Mhm.
We'll offer that. I'm partnering with Leslie from the Respite Care Association of Wisconsin, and in November for National Family Caregiver Month, as luck would have it, we're going to be partnering on a presentation for the Coalition for Children, Youth, and Families. And that is targeted toward statewide in Wisconsin, but specifically to grandfamilies and kinship 55 and older, so that we're not marketing support and grants and funding for people who maybe aren't eligible, but really trying to narrow down the scope and frankly, the eligibility of who we can actually touch and support. And if with any kind of luck, by the end of November into early of next year, you guys each in your county should experience a couple referrals, just hopefully that way. A state agency offering this very specific support, and then learning both about NFCSP and then the respite care grants through RCAW.
Well, if there aren't any other questions for me, I'm gonna log off at this point. However, again, you have my contact information. So please, I encourage you to reach out to me if you do have questions.
Thank you so much, Leland,
Thank
especially
you.
with your illness. Thank you so much for your time. Feel better.
Thank you. Bye.